Lucy, will I be able to see when people have joined? Yes, participants, I've got it. Ladies and gentlemen, people are just joining. We'll give it a few minutes for everybody to sign in, and then we'll get started. If you just bear with us for a few moments. I'm just going to give it another minute for those who might be having difficulty to be able to join. We had 40 names in the frame to attend this webinar. There are people starting to appear still. So we'll just give them another minute or so and then I'll get started. Okay, I think we've given that long enough for people to have time to get in. There may be some others join. Welcome to this webinar from the HCRI online suite of programs. I'm Darren Walter. I'm the Program Director for the online programs at HCRI. And today's webinar is talking about our Global Health MSc. For people's awareness, this is being recorded. It will be made available by HCRI for those who want to rewatch me, or for those who were unable to join us, who want to catch up on what we're offering for Global Health MSc for the coming year. In about half an hour, one of our students, Mark Tan, is going to join us. And when I finish my relatively short presentation, I'll invite Mark to give you some student comments. Lucy Darovska is our professional staff member who's facilitating today. She'll be watching the chat. If you have any questions, please type them in the chat and Lucy will share them with us. She's going to sort them and share them, and then Mark and I will address those at the end of the session. As I said, it is all being recorded, but if there are questions asked, they will be anonymous questions, so feel free to ask. The answers will be part of the recording, but your individual contributions won't appear, so you will remain anonymous. Having provided that level of assurance to you, here we go. So, if we can make this work. What am I going to do? In the next few minutes, I'm going to give you a little bit about the history of HCRI. I'm going to talk about the background to the MSc Global Health and our online suite of programs. I'm going to tell you a little bit about what you'd study. I want to explore with you what is involved and give you a little bit of a flavour about how our online programs currently work. And all of that, ideally, in 30 minutes. HCRI is now in its 13th year. It was created in 2008 by a small group of Manchester academics who were responding to a demand for a centre of excellence for humanitarian action. The aspiration of those who formed it in 2008 was to bring together academics, practitioners, policymakers to bring a whole breadth of academic specialties and field operatives into one environment to address the academic study of those areas of interest to HCRI. HCRI is truly multidisciplinary. It brings together medicine. I'm an emergency physician. I still practice in hospital, but for 3.5 days a week, I belong to HCRI. So I'm still practicing medicine. Mark Tan, when he speaks to us, is also a junior doctor. But we have scientists, social scientists, anthropologists, historians, people who specialize in the humanities, all working together as part of the University of Manchester, and administratively we sit in the School of Arts, Languages and Culture. It's just the administrative process. We are multidisciplinary, and I have a foot in biology, medicine and health, as well as humanities. And we bring together humanitarian aid, disaster management, conflict response, and development studies in this one place. We are social responsibility in action. And any of you who have been watching the academic Twitter feeds from Manchester will have seen that the University of Manchester was rated #1 globally by the Times Higher Education Supplement recently for social responsibility. They're really quite proud of that, and quite properly so. I talked about our multidisciplinarity. Within humanities, our director, who is just stepping down and a new director stepping up, is a historian, anthropology, sociology, politics, international relations, even the dramatic arts and geography. But the applied sciences, emergency medicine, that's me, global health and epidemiology, that's part me, but there are others brought in here, nursing, development studies, peace studies, education. We cover the full breadth applied to humanitarian studies and global health. Our unique selling point is the fact that we are so broad. We were early implementers of this breadth. The three faces you see: Bertram Tate, our modern historian who's just stepping down as director, is a historian. Next to him, Professor Tony Redmond, who retired 18 months or so ago, led the medical side, and Roni Broman on the right there, At the time that he signed up to HCRI, had just demitted office as president of MSF. They brought together this field to create a dynamic and involving environment that responded to need. And the key focus was people actually doing it. It is not academic study purely, people sat in their ivory towers critiquing what's being done. It's people actually doing it. And Tony Redmond is renowned for being, he was the director of, and he's now chairman of the charity UK Med. The picture from BBC News is from the UK Med deployment to Typhoon Haiyan. UK Med is still out in a number of locations in Africa. It's currently still in the Lebanon, working with COVID management after the Beirut explosion we all saw last year. Many of our staff are part of UK Med. I am myself, and we are involved with delivering humanitarian practice in the field, as well as critiquing it and working with many of the NGOs and official organisations. In a fortnight's worth of meetings, I will be talking to MSF, Save the Children, United Nations High Commission for Refugees. We are a spider's web with threads running into a lot of the actors involved in humanitarian response and global health. Our online suite currently stands at Global Health, which we've been running, it's now our 8th year. Humanitarian Practice with our LEAP programme, which is in collaboration with Médecins Sans Frontières, and the Liverpool School of Tropical Medicine is in its 3rd year. And our MSc in International Disaster Management and Humanitarian Response is entering its 2nd year. Our aspiration is that we mirror our face-to-face programs for postgraduate programs. So if you came to Manchester and spent a year studying with us, you could also do it distance learning and part-time and cover most of the content that you could have achieved had you been on campus. Now, obviously, there's a difference between the way the modules run, but we're aspiring to have the full breadth. We're developing increased flexibility. And if you joined our global health program in September 21, I'm hoping you will see some of this flexibility during your transit through. But the university is a little bit like a super tanker in terms of its changing its trajectory. So the modules I'm going to present is how it looks today, but I'm hoping that within 12 months, you would start to see some of the flex that I'm going to talk about as we go through. We are a globally diverse community. Yes, a lot of our students are from the UK, and we have a fair number from Canada and the USA. Time zones are challenging in Australia and New Zealand, but we do have students there. But I'm particularly proud of our student reach out into the African continent and into the Indian subcontinent, into Southeast Asia. We have a lot of students who are actually doing global health and enhancing their careers with the part-time study. And we have a lot of students, as we'll talk about, who change their trajectory or interrupt because of circumstances. Within the last couple of weeks, I've had students who've been presented with problems with what is the media will eventually come to call the genocide that's happening in Tigray at the moment. We have other students who are in Cox's Bazar in Bangladesh dealing with the Rohingya, and some of them are running into logistics challenges, and we're flexible enough to allow them to continue their study or stop their study for a period and then come back to us when their personal circumstances allow. So we have a spread across the globe. But why global health? Well, global health is all sorts of things to all sorts of people. And if you've been undertaking your due diligence and you look at global health online degrees in the UK, you'll see them offered by a number of the Russell Group, the leading universities in the UK, where they offer global health. But I would ask you to think, how different is the global health that's offered from the standard public health degrees that are also available online? And because it's Manchester, I can say we talk about the operationalization. And this selection of pictures picks up on some of the history in the top left, but some of the challenges in the Middle East with the violence, particularly within the Gaza Strip recently. We have some academics who have a particular interest in the Levant, and they've been particularly vocal in the last few weeks because of what's been going on with the Israeli-Palestine conflict. There are always challenges within North Africa and East Africa. We have lots of issues with refugees, and there's an awful lot going on at the moment with COVAX. But if you wind that back, humanitarian relief delivered to crises is needed long term in many parts of challenged parts of the world. And it's not just a focus on COVAX, it's a focus on food and nutrition and healthcare more generally. And that's where global health has its focus. These are my own personal photographs trying to deliver emergency care in the top left, which is a hospital up near the South Sudanese border in Uganda. The ambulance on the right there is parked outside a regional emergency department in northern Uganda. Bit of a challenge getting your ambulance response when that's your asset. Your environment. This is Gulu, which is one of the more challenged areas, and I'm delighted to see how quickly it's developed and evolved since the peace agreement in the late noughties. You don't see a great deal of these slum environments that I took that picture of 14 years ago, 13 years ago now. And children the world over are the same. We just need to do what's right for our future. The kids are a delight wherever I've been. Social determinants of health. This is now 30 years old, and it's a complex picture, and it says global health is not just about healthcare. It's about lifestyle, it's about social and community, it's about the general economy, the culture, the environmental conditions. There is an evolving area of climate studies in relation to humanitarian response. And in the last year, Stephanie Sodero has joined us in HCRI, and her interest particularly relates to the impacts of climate change in the humanitarian environment. This is 30 years old. You can see how graphic design has improved, but Healthy People 2030 is the current driving force behind the social determinants of health. And this illustrates how education, access, healthcare, the environment, the economy, and the social and community context are all part of global health. And if you join us, we will not just be teaching you about medical care provision, we'll take you right back to alma mater and primary care, the delivery of horizontal basic healthcare improvements, but also how important education and shelter and social environment are to improving the health lot and improving the general state of health of communities that are challenged. These are pictures that again I took. That hospital on the left, in the top left, is a lot more attractive than many NHS hospitals, but that was a hospital in eastern Uganda that's delivering really quite top-notch care. We don't hang out our surgical drapes to dry in Manchester. They'd never dry with Manchester weather, but the surgical processes in that Lacho hospital in northern Uganda, you can see they've got an organized system for their healthcare. Delighted to be at the graduation of a new medical school, first cohort of medical students in northern Uganda, 70 graduates, and one of them, Julius, is on the right there. Intern 12 months after graduating from medicine, he was He apologized for keeping me waiting when he came to meet me, because he'd just been doing a cesarean section, saving a woman's life, saving a baby's life, 12 months out of medical school. Really quite phenomenal healthcare, top-notch healthcare, if it's built properly, if it's supported properly, we can make a difference. Within the global context, many of you will know about the SDGs. We had the Millennium Development Goals to 2015. We're now in the SDGs. When I talk to undergraduate students, medical students, they're all focused on number 3, good health and well-being. That's health. Well, yes, it is. But poverty, hunger, education, gender equality, water, sanitation, hygiene, all of them, all 17 goals have an impact on the health of communities in challenged environments. And as part of our global health program, we will endeavour to operationalise this for you. WHO is a major player. We are a WHO collaborating centre, and this emergency care system framework is close to my heart. Terry Reynolds, based in Geneva, helped create this. I've been part of the rollout of this programme, but in essence, this diagram sums up the delivery of emergency care. It's not just about emergency departments and hospitals, it's about training in the community, response systems, ambulance services, proper services in the hospitals, and rehabilitation, return to taxpayer status, as the Exchequer, the Ministry of Finance, would refer to it. And in some of the modules, we'll take you through the integrated nature of healthcare within the community for the best results. Mohammed Yunus from Bangladesh is well cited as saying, one day our grandchildren will go to museums to see what poverty was like. Absolute poverty is fading. When you listen to the media, perhaps you don't believe it, but this distorted map from World Mapper shows you where absolute poverty is to be found. But it is decreasing rapidly, and the SDG Goal 1 is about reducing absolute poverty, and we are on a substantial improvement trajectory, and we need to position ourselves to manage the healthcare around the neglected bottom billion who will find themselves still in absolute poverty, to address that. There is momentum. You may or may not be aware that the UN celebrated 75 years last year, shaping our future together. The UN sets goals, and yes, there's lots of people who are critical. No, we didn't achieve the trajectory. No, we didn't quite get there, and they're right. But it's really difficult to predict the future. You need to push for it. You need to drive for it. We're 5 years into the SDGs now, and there's been a lot of deep breath taking. Right, where are we? Where do we go for the next decade? And because emergency care is my thing, I thought I would bring something that's very contemporary to you. Last week was National Road Safety Week. We have a decade of action for road safety, and these two graphics from the UN Road Safety Week, which has happened this month and is really driving the kill your speed, not a child agenda, deal with road safety, accident prevention, reduce the non-communicable disease burden of trauma. We want to be on the front foot. We want you to be on the front with many of these initiatives. We're not just regurgitating the same old, same old. So if you come to us, what's involved? Engagement. You're part-time. You need to put aside 15 hours a week for our programs. It is asynchronous learning. So you dip into our Blackboard site, you access the material, you take away the reading and do that. That's all included in the 15 hours. You engage with the content, you engage with your peers in directed group discussion in the Blackboard space. But you do not have a particular time of the week that you need to log in, because we have people spread across the globe. It's a bit difficult, certainly with some of the dissertation conversations I've been having with students. I've had students in the Caribbean at 7 in the morning and in the Antipodes in New Zealand at 2 o'clock in the morning. It's really difficult to get that right. So the majority is asynchronous, but we do try to offer and are increasingly offering synchronous meetings for those who can drop in. And in the modules that I convene, I run 4 during the 8-week block where you can drop in if you can. We have a conversation, it's recorded, and the link is uploaded into Blackboard. So those it wasn't convenient for, time-wise or work-wise, can see the nature of the conversation. So 15 hours a week, all told. Some of it in the Blackboard space, some of it writing your contributions, and a substantial part about watching videos and reading material to enhance your learning. We operate via modules. A module is 8 weeks, and when that module finishes, there is then 1 week after for you to finish off, for you to finish your engagement, complete the assessment, and submit before you start the next module. So a module is 9 weeks. There's a new module every 9 weeks. There's a break at Christmas, there's a break at Easter for 1 week each. And that gives us 36 weeks per year, 38 if you include Christmas and Easter, meaning you'd start at the end of September and run through to June in an academic year. That's what's involved. The program is part-time over 3 years, and people want to know the cost. The costs will be held at the rate on your year of entry. For academic year 21-22, that's entering this September, and we have entries in September and in February. Standard university master's fee is 10,000 in total. And that's 3,333 per year for 3 years. We do offer a low and low middle income bursary support system. If you are from a low or low middle income country, or you reside there, we will carry some of that cost for you, and the cost is discounted, and that's carried by HCRI as part of our social responsibility. You get a discounted rate. There are a couple of Ellis Roberts bursaries for the PG certificate, which is the first year. More on that in a second. But Mr. Ellis Roberts, an alumnus of the University of Manchester, has invested for a number of years in providing a small number of bursaries to support students from particularly needy situations to enter University of Manchester higher education, and the Ellis Roberts bursaries are run annually. In fact, I'm due to speak to Mr. Roberts on Friday to update him on where we are up to with his bursaries. English language, it's important that you can write and communicate well in English. We require an IELTS overall grade of 7.0, but a minimum writing score of 7. We get some who have great communication oral skills, but their writing skills are challenged. We need your writing skills to be such that you can communicate in the discussion board and in the assessments at a level commensurate with a high-level university that Manchester is. There are a number of different scaling systems, and our admissions process can transcribe those a little bit like a financial exchange system. An iTOEFL of 100 plus with a minimum writing score of 25. I'm not going to go into the detail, it's not my area of expertise, but the admissions team have that. But because of COVID in particular, but sometimes because of the location, and we know British Council centres have been closed, so getting your English language testing during the COVID pandemic has been a challenge. We do have an English language formal waiver process for those who don't meet the grade, where we evaluate whether you would meet the grade to get you in, but your English language needs to be pretty competent for you to enter our program. The program outline then, I mentioned the certificate. We advertise it as a master's. A master's is 180 taught credits. A module is 15 credits. So you do a year, 4 modules, 4 times 15 is 60. If you pass your 4 modules in year 1, if you chose, you could exit with a postgraduate certificate in global health. If you came and did year 2, you would have done a further 4 modules. That will give you 120 credits, and you could exit with a PG dip in global health. If you then do your master's, you submit a dissertation in year 3, that gets you the full 180 credits, and you would graduate with an MSc in global health. So you do the 8 taught modules in sequence, and then a dissertation, and that's your whole program. In terms of the modules, this is the bit that's going to evolve. Today, these are the modules that you would be taught: risk, vulnerability and resilience, systems and markets, ethics, human rights and health, and community approaches to health is your certificate. In your DIP, diseases and trauma, management and leadership in humanitarians and health, disaster preparedness and research methods. Because we're offering 3 online programs, you will find other students in these modules alongside you. You will certainly, in risk, vulnerability and resilience, ethics, human rights and health, and management and leadership, you will find quite a lot of students who are MSF field operatives who are also doing those modules alongside you. So the conversations will not be purely academic. You'll be having people who are telling you what it's like, what they're doing in the refugee camps and in the disasters that they're at right here, right now. And this is some of the operationalization that our modules and our programs offer that many of the more purely academic global health programs perhaps don't. But of course, I would say that because I'm a Manchester program director. In terms of the dissertation, people get very focused on this, and so you should, because it's a large piece of work, but it's a student-generated research question. We run a dissertation module over the first 8 weeks, where we help you create and refine your research question. We walk you through some of the ethical issues, and you're allocated an appropriate supervisor who will then work with you over the rest of it's about 10.5 months that you will take to deliver your full dissertation. And you work with that supervisor to create a 12 to 15,000 word thesis. And the important thing here, some choose to do primary research. Some do secondary data research. Some do secondary literature analysis. The dissertation requires an original piece of work, but it doesn't need you to do primary data collection. If you wish to, we will facilitate that, but you don't have to do it. And certainly with COVID, we've just finished the 8-week dissertation phase for the February-March starting dissertations. And of the 12 students who are in that dissertation module starting in February, all 12 are doing secondary data research, secondary literature analysis. Nobody's doing primary research this time because logistically getting in there and doing the primary research is difficult because of the lockdowns and the lack of travel. But we want you to deliver something that you're proud of. A dissertation isn't automatically publishable, but many of our dissertations have content within that can be transcribed into an academic paper that is publishable. And if you choose to do that, you can work with your supervisor to create a piece of published work out of it. We have a consistent approach. You enter the Blackboard. This is one I've screenshot I pulled down from one of my modules. There's a notice board, there's the module content. You have full access to the University of Manchester John Rylands Library. There's the discussion board, a learning journal that is a means by which we can communicate with you and we can capture your contributions as an individual. There's the, I'm afraid, there's the inevitable assessment. And then there's learning support and access to all the learning support systems that the University of Manchester offers to its on-campus students, as well as its distance learning students. And this format is reproduced in all of our modules. I talked to you about synchronous meetings that are a bit of a challenge because of time zone differences, part-time students, workers on shifts, but they're always recorded and a link is uploaded to Blackboard, so you won't miss it. It seems to work far better for the dissertations, but I think that's got something to do with how focused people's minds are on their dissertation. But we are increasing the number of synchronous meetings from 3 years ago where we didn't do any at all. As I said, my modules, there tend to be 4 now, and I'm encouraging all my module conveners to do the same. University regulations, certificate, diploma, master's credits, you need to complete within 5 years of maximum. Now there's a little wriggle room, and I have to say, I have stretched it for some people. I've negotiated and argued for flexibility from the school and the university, and they've given it. We know there are mitigating circumstances with interruptions. There are life challenges, flexibility, and I'm the program director. It's my job to get you through this and come out at the other end. Just to mention life challenge, my favorite mitigating circumstance is a lady who wanted to interrupt, but she had to interrupt early because she went into premature labor. The university said, can you provide evidence? And she sent a picture of a baby in an incubator and a birth certificate to prove that the baby had arrived early. There was no issue, but it was the most convincing evidence of mitigating circumstances we've seen. And also a really nice one. She's just returned to our programs, actually. So university regulations are followed, but I will go into battle for you to stretch it if your circumstances require it. We do get graduates, American, European, and a consultant physician from London. That's from a couple of years ago now. You get to come to Manchester, you get to attend graduation ceremony, COVID allowing, but hopefully by the time you're graduating, this would all be done. It's one of the real pleasures of being part of the program that our students do travel to get their graduation certificate from Manchester and get to see the people they've only been communicating with virtually during their course. It's a great joy. Careers, where do these people go? Well, because we are operationalizing global health, a lot of our graduates are with us because they're interested in being involved in the humanitarian and development sectors. So quite a lot go to the NGOs with Oxfam, Red Cross, Save the Children, MSF. A number go into civil service, Foreign Commonwealth Development Office, what was DFID. Research institutes and think tanks, they go on to do PhD studies. They work with the United Nations and peacekeeping, and sometimes with the regional bodies, with the EU, the AU, the Organization of American States. These are destinations of some of our students recently. And with that, I would normally go over to you, but I'm going to invite Mark to speak for a few minutes. Mark Tan, anaesthetist, wearing his cap and scrubs just to prove he genuinely is. Thank you, Mark. To give you a few moments of a student's perspective of our global health program, and then I'll pick up on some of the questions that might be raised. Mark, over to you. Thank you.
Hello. Hi, Darren. Can you hear me?
I'm gonna try stop screen sharing and over to you. Away you go, Mark.
Can everyone hear me? Yeah.
Yeah, they will be able to.
So yeah, hi, my name is Mark, and I am an anesthetics and intensive care trainee in the northwest of England. And I'm also an academic clinical fellow with the NIHR. And as part of that, I'm doing my Darren's MSc in global health. And this is because my interests lie in critical care in low resource settings. So I am now a year into the masters, and I will have some time later on the line to do my dissertation, which I've not exactly formulated a question for yet. Alongside this, I'm doing obviously full-time medicine, so full-time anesthetic and intensive care training. So you can imagine that I still have on-calls and I still have clinical duties that I have to fulfill alongside the masters.
Okay, Mark, do you want to talk about your experiences, some of the modules? How have you found it with some of the students from some of the other online programs with the MSF people, etc., in your modules?
So actually, a lot of the modules have been quite interesting, and it's great to learn not only wider systems at play in the global health scene, but also learn from the experiences from many other people. So we have, so on the module I'm currently on, we've got, I'm sure people from all over the world, some clinicians, some non-clinicians, but involved in the NGOs. And so they bring a far wider point of view compared to what I'm used to studying undergraduate medicine, which is very refreshing, insightful, and challenging at the same time.
Okay, what surprised you most? How have we wowed you most?
So I've done a PG cert in another university with Blackboard, and actually I have to say that the structure of Blackboard for global health for this master's has been really good and intuitive, easy to use. The resources are well structured, well researched, and it does point you into many directions that you can take your reading into. So I've been surprised at how well Blackboard works, considering I've had a less ideal experience somewhere else.
Okay, and because they're all interested, tell them the worst bit. And I've not marked your papers yet, so be careful what you say about me personally. Which has been the worst bit? What's been most challenging for you?
So I think, as you can imagine, trying to juggle, what you need to read and what you need to write with clinical duties has been challenging. So I remember I started off on an A&E placement, and that was, and we've also got a young child at home. So she was born in the middle of the pandemic last year, and that was pretty much when I started some of my modules the year before. And so that was very challenging. But we do, you find ways around it. You find ways to make time to read and write. I try to use as much of my downtime within clinical practice to do as much as possible. So for example, if I am on call for anesthesia and it's a not so busy night, then I would take the time to do the readings and writings so that I can spend time with my family when I'm off.
I should just reinforce, Mark, I'm sure you won't mind me mentioning, you have interrupted during your time. We do, I referred to the premature baby arrival, it wasn't Mark's. we naturally interrupt to help people. We try to help you through. We are very flexible, and I have a number of clinicians, both medical and nursing, who, because of postgraduate exams, want to focus on their professional exams for a period and pause for 6 months, 12 months to get their professional exams and then come back. That was completely new to the university. We have persuaded them of the wisdom of doing this. And it's a lot easier to do that sort of interruption, that pause your studies. They've always been used to life events with ill health and with unfortunate things like bereavement, and they're very sensitive and reflective there. But the professional adaptability, we've been fighting an action to gain recognition for that, and the university is completely signed up to this level of flexibility for people. I'm pleased to see Mark's nodding because he's taken advantage of some of that flexibility. We're fighting the good fight to get students on board and get them through. Mark, I've got a number of questions that people have asked. Is there anything else you want to say about the program? And then I'll pick up the questions. And the ones that I can see are all for me at the moment. But is there anything else you'd want to say at the moment?
No, not really. I mean, I echo what you've said about flexibility and acknowledgement of both professional and sort of personal circumstances, and that's been very helpful for circumstances like my own. But I think that's probably as much detail as I'm going to go into.
Oh, that's absolutely fine, Mark. You're entitled to some privacy in there too. Okay, I've got 4 questions. Something's just popped up. Is a general training IELTS acceptable? I'm going to hold my hands up and say I am an emergency physician academic. Lucy's answering that question, but that goes through admissions and they will be able to answer that. I'm hoping Lucy, as the professional staff, are going to answer that question for you. Now, I can't personally answer it off the top of my head, but we will get you an answer. Oh, next question. Why has the cost of the course gone up? Yeah. How did I know that question was going to come up? Right. Master's qualifications at UK universities, fees are £10,000 a year. International fees for the same program are £20,000 a year. We have been able to hold the fees down from a social responsibility point of view to the low and low middle income rates. But the university has been pressing us very hard, and through COVID, the degree of financial viability of the programs has been really challenged. And it's become very difficult to defend a master's at 2/3 the going rate for global health compared to all the other online programs that are offered by the university. And we've been forced to give way, which is why the standard fee for a high income country person is rated at 10,000, which is what it is for all of the students. We are still able to support those from low and low middle income countries with the discounted rate by carrying it within HCRI. So we are carrying that. The university is still expecting the charge of 10,000, but we're absorbing that within our teaching budget in HCRI to continue to encourage global involvement. I am incredibly uncomfortable. I am not happy about it, but I am an employee of a very large university, and when it says jump, I have no choice. So we've been resisting. Certainly this is going to be my 4th year as director, and it's come up every year. And this year I've had to give way, and the conversations have been happening over the last 6 weeks. So to the person that asked that question, who's listed here as anonymous, that's where it's come from. I hold my hands up and apologize. If you can find a discounted global health degree that meets all your requirements somewhere else, A, go for it, and B, please let me know. But I'm sorry, I'm not able to dictate what the big university requires of us. Next, are there optional modules available? Right at the start, I told you that we are in evolution, and I've just given you the train tracks. The train tracks are you enter in module 1 and you will progress through to module 8. I am aspiring for there to be 4 core modules and 4 optional modules, and you to be able to choose your optional modules. I am aspiring for that to start in the next academic year, but this requires the school and the faculty and the big university to give it their blessing. And as I referred to the supertanker, it takes time to get approval for all of that. Yes, we are working on optional modules. The humanitarian practice degree has it. Disaster management has it. Today, global health doesn't. I aspire that by the next academic year, it will do. And I have 2 case studies to illustrate the point, and we do have those modules. But it's one of those I can't change until they say yes, because there are already students in the program. But I am aspiring that you will have optional modules. And you're going to say, what modules are available? And I would say to you exactly what I said to the director. Every module we deliver face-to-face should be available online. Now, that is a trajectory, and COVID has done me wonders as director of online programs, because all my lecturers who were saying, oh, it has to be done face-to-face in lecture theatres have spent the last year delivering it online. So it is now available online, but we need to be able to operationalise that and get the blessing of the university to do it. So if you look through the HCRI site and you look at what modules are available, the aspiration is that all of those modules would be available as optional choices. But right here and right now, I can't promise you that. I'm aspiring it in the next 12 months. How many people are on the course in a year? With a PG Cert year, we range between 45 and 60. The diploma ranges between 20 and 40. And the dissertation is normally about 20 to 30. You heard me refer to 14 students in their dissertation. Now, remember, that's the February start. Because this last 18 months, we have started twice yearly programs. So you can join in September, you can join in February, all part of the increasing the flexibility. The overall headline numbers difficult to cite to you, but in terms of doing their dissertations from global health, it's of the order 20 each year. So you can see it decreases as people choose to exit with the certificate, the diploma, and the masters. There's a question about how you apply for the reduced rate if you live in a low middle income country. In your application, you make that a part of your personal statement, and the admissions team will pick that up. Full scholarships, the Ellis Roberts scholarships are the only scholarships that fully cover fees, and they only fully cover the PG Cert year, and there are typically 2. So those are the only full scholarships we offer. Somebody's also asked any financial aids at all. It's an anonymous person. The other financial aid will be the low middle income discount. Reduced rate is the other financial aid that we're able to offer. We have to come in as financially viable. We're broadening out, we're increasing flexibility. That requires more academics. The university is trying to push us to increase our rates. We're trying to drag our rates down, and we end up at a line, and I've tried to define the line. I still want fully discounted global health rates, but I'm being dictated to by the big university, and I can't get out from under that. If anybody knows some generous benefactor that will bankroll that difference, I'd be very happy to talk to them. But we don't have anybody other than Mr. Roberts at present.
Can I just add to that a little bit? So because I'm an academic clinical fellow, so with the NIHR, the ACR, and I guess it's only UK physician or doctors who are available to apply for that, but they fund my master's, so they are the ones that are funding. It's obviously full cost, but I'm not paying it. It's being paid by the NIHR and the ACF program.
So for some students that come through, they're funded by other sources. We are developing clinical fellowships in my emergency department that will pay for people to do their master's programs and do the diploma in tropical medicine at the Liverpool School of Tropical Medicine. We will pay their fees as part of their employment. There are various ways of doing this, but they're not things that we can offer to all students who apply to HCRI. Is an English proficiency attestation from place of previous study acceptable? If you look at the English language requirements, and you look at the waiver process we use, then an English proficiency attestation is part of the waiver process. There's more to the waiver process than that, but yes, there is a properly accredited way of using attestation of prior academic centres. But I personally don't know the English levels at every university across the world, and we've had one or two people who've been challenged by that. So yes, it's part of the waiver process, but it's not just I have this letter from an academic elsewhere. There are other tiers of protection and assurance as part of that. But yes, there is a system. How do you apply for the Ellis Roberts scholarships? Follow the website. There are instructions in there within the HCRI website. Maybe Lucy, if you could put a link in the chat for the Ellis Roberts scholarship. The person asking the question is the one that asked about living in a low middle income country. So if we can provide a link to the Ellis Roberts site in the chat, that would be great. Okay, and I've run down to the end of my questions. We started 5 minutes late and magically we're 2 minutes early. So I'm going to pause for a couple of moments to see if there are any other questions. You can probably see I'm watching slightly off to screen left to see if anything pings up. While we wait, can I thank Mark for his time? I recognise the standard Mark 1 NHS room that you're sat in with the sink behind you. Thank you for joining us from a clinical shift. I can tell you, if you worked in my emergency department, I wouldn't have let you take your foot off the pedal to come and talk to us. Anesthesia is much easier and less pressured than emergency medicine. But thank you for taking the time to come and join us and for your contribution. Lucy, thank you. The link for the bursaries Lucy has put in the chat. Thank you for that. Can I thank all of you for your attendance at our webinar today. The recording, I think I've been scrupulous in keeping it anonymous, but the recording will be made available by Lucy and the system for anybody who's missed anything. If you have any questions, please feel free to email them in and we will endeavour to answer them. To those who might be a little disappointed, I can promise you I'm as frustrated as you are about price rises and flexibility. I'm on your side, I'm fighting to improve the flexibility as quickly as I can and to keep the prices as low as I can. But I came to global health quite late. I'd been an NHS consultant for 8 years when I first engaged. Now 12 years later, I'm part-time at the hospital. I'm a university employee. Global health, particularly global emergency care, is my thing. It's where I feel I can make most difference. And it's completely changed my career trajectory. It is the most satisfying, impactful area of healthcare. But of course, I would say that. Mark is still young with no grey hair. He's on a much earlier trajectory. He saw the light before I did. I hope many of you will choose to come and join us. Please continue to ask your questions. Thank you for your time and engagement today. And somebody just put a last question. Oh, Lucy, I just saw a question, then it disappeared. Okay, that was about.
I've just answered it on the.
That's great. Thank you. Thank you to everybody for your time this afternoon, morning, evening, wherever you are. Thank you very much. Stay well. Good luck, and we hope to see you in September or February, whichever suits you best. Thank you very much, everybody.
Bye-bye.
Okay.